So today is the first day of summer. It is June 21st, 2018. We are on our way to see the doctor because I'm going to be having surgery. I have no jewelry on, no makeup. I don't even have my contacts on. The procedure is that I'm having, it's called the NovaSure Ablation. I've asked a lot of questions, and one thing that I've learned is that every case is different, every body is different. We're quick to say, maybe you should do this, then that. This all stems from my thyroidectomy that I had 3 or 4 years ago. What happens to the woman's body after they have a full thyroidectomy? I'm not talking about like if you have thyroid issues and you still have your thyroid. One thing that I did not know is that once your thyroid comes out, your body changes. And of course, I think that's with anything that happens in your body. God made us in such a particular way that if anything is taken out or anything artificial is put in or anything, it's just not natural. So your body tends to have some kind of domino effect. You're affected in some other way. And in my case, I can't say I've gained weight. Lots of people say that when they have thyroid issues, they gain weight. My weight has pretty much stayed the same. If anything, I've lost some weight. In my case, it was my menstrual cycle. The only thing I complained most about. So it was just so heavy. I always felt like I just had a baby. And for women who have had children, we know that there are 45 days where it is major after having a baby. So that's what happens to me once a month for a whole week. I went to the ER, they took my blood, they didn't know what was going on. I know I felt really sick, like my jaw was shaking. I felt like I was gonna pass out. I felt so weak. I was so nauseous. I hadn't eaten I wasn't eating good portions of food, so I lost 9 pounds in like a month. The ER, they said, well, you're dehydrated, but they didn't really look at the lab work. So by the time I went for my follow-up, the doctor looked at the lab work and said that all of my vitamin levels, all of them across the board, magnesium, potassium, calcium, vitamin A, D, iron, you name it, all of them were literally on the floor. They were so low. And then they were doing a bunch of tests trying to figure out what it was, like maybe if it was cancer or who knows what was going on with my body. Finally, once all of the doctors started talking to each other, which is another very important thing, all the doctors need to be communicating. My family doctor with my gynecologist, and those two with my thyroid doctor. The one thing my thyroid doctor says to the other doctors is she always complains about her blood flow. And that then sounds an alarm and says, this is what's happening. You have that week where you lose all of your vitamins, all of your nutrients, and then you have 3 weeks to make up for it, eating meat, broccoli, eating good to make those levels come up. But they kept going down every time I'd have a period. So it'd go down and come up for 3 weeks and go down and come up and go down till finally I just had nothing. I completely depleted within those 3 years or 4 since I've had my thyroidectomy. And this has brought us to now the ablation. The NovaSure is literally, they're gonna dilate me. They're going to put in a wand and it's gonna like open up a mesh, like a small like little like balloon, and that's going to electrify the uterine wall. It closes up, take it out, that's it. So I'm gonna feel like I had a baby, and I'm gonna be in pain because it's a painful procedure. I'm gonna be under. It's a quick procedure. It'll be about an hour, and then my body needs to just get back to normal. They're doing that rather than a hysterectomy for these reasons, and this is where you have to talk to your doctor, okay? If you've had a thyroidectomy or had thyroid issues and you're in your 30s, 40s, or 50s, the reason why I'm not having a hysterectomy is because I'm 41 rather than 51, and also because I'm 41, I have a lot of estrogen, so I'm not close to menopause. Some people are closer to menopause, and that may be a reason to have your hysterectomy now. Or of course if you have fibroids and things of that nature. But if everything is wonderful, your ovaries, your fallopian tube, all that stuff looks good, then do not do the hysterectomy because that's just gonna rush the process of jumping into menopause. And if your estrogen levels are good, and in my case they are, I wouldn't want to do a hysterectomy, including the thyroid doctor say, yeah, don't do the hysterectomy, because I have other patients who have had a thyroidectomy and a hysterectomy, and it is hard for me to keep their thyroid levels maintained, and I don't want you to be one of those girls. So that's why I'm having my ablation. I'll be in surgery in about an hour, and I just want to thank everybody for their well wishes, and I hope that this video somehow helps somebody, and I'll see you soon as I recover. I'll do another video. It is recovery time for me. It is, I think, about 1 in the afternoon. So that's almost exactly 24 hours since I last posted. I'm laying in bed at this point now. It's just recovery today and tomorrow, depending how I'm feeling. And I love my job because I'm able to do it from home. So I'm just kind of working here. How do I feel? Yesterday after the surgery, which was pretty interesting, got there and they put an IV and then transferred me over to the operating room. My doctor definitely was, I like that she was very thorough and that she told me what to expect afterwards and what I would be feeling. I loved the drug that I was on. I mean, he literally said goodnight and put that baby in and I was gone. So it felt really fast, and it took about, my husband says, not even a whole hour by the time they called him back in. And when I was coming to, the funny thing is that the first thing that I really saw was this little boy. He had to be maybe 7 or 8 years old, and he had his soccer suit on, like he was there probably with his mom. And I thought of Jolito right away because my son Jolito loved soccer and he used to always have his uniform on, and he was on a team when we lived in Michigan. And what was that for? I'm high and I see this little boy and he's so cute in his uniform, and I'm thinking about my son. So of course I start crying and I'm like, do you remember? And I'm like talking weird. Do you remember Jolito in his uniform? And then the lady's looking at me like, this, is she like really crying? And I explained, it's just he's in the army, he's far away, and gave her some details of what my son does. And so that was fun. So I like the fact that I came to thinking of something great and having good thoughts. So had my drugs already ready the day before. So when I came home, that's when the pain started, because the anesthetic was already wearing off. I had some Vicodin, some drugs that they gave me, and the first 4 hours were very, very painful. The first 4 hours were very painful for me. She said it would feel like I'm having a baby, and she was right. I was literally on all fours, like in a fetal position, like, yeah, I was just bent over, and I felt the back pain of labor. I know I said to my husband, I feel like I'm having Melody all over again. And for those of you who know, my last child was breech. She came out butt first. And I felt all of those pains. So it was really weird because there's no belly, there's no pregnancy belly, and there's no baby. But you feel all of the pains. There's no tightness of a contraction, but you feel all the cramping of the contraction. So to say, oh, it'll be something really quick, you're gonna go home and it'll just be a little bit of cramping. Cramping is like when you're on your period. No, that was intensified by 100. So that was, I like, the nurses would say, it's just gonna be a little bit of cramping. But the doctor was like, you're just gonna feel like you're having a baby. And I'm glad that she said that. Otherwise, I would have thought, okay, so it's just gonna be a little cramping and I'm gonna feel uncomfortable. So for the first 4 hours, I would say that my pain level was at a 10. I was in a lot of pain. But as you take your drugs every 4 hours, then it subsided. By 10 o'clock at night, I was better. I think I was, maybe the pain level was at maybe an 8 or a 7. So it wasn't that bad. Today, I woke up this morning. My husband got me up every 4 hours to take the drugs. So I was up at 1 in the morning, and then And that worked because by the time I woke up in the morning, 8 o'clock I think I woke up, I felt good. And right now I feel good, and it hasn't even been 24 hours. So that is a good thing. That is my brief update. So I'm just not gonna go upstairs and do too much with my body. They did say that and this is detailed. So if you're a guy, you shouldn't be watching this. I'm sure more ladies are watching this than men. The discharge is water and blood. Very little bit of blood, but lots of water. So I'm sure that they must put something in there during the procedure that causes water to discharge, and I was told that as well. Now tomorrow and the next day, I'm sure then it's going to be a little bit of all the burning residue that then is going to be what I'm going to be seeing. So gross. This is the stuff that us women go through, and I won't go on a rant about how men go through absolutely nothing, because I've done that, I think, for the past year to my poor husband.
A man has no excuse when it comes to being healthy, because they work. So their body should be somewhat proportionate, healthy, with muscles. They don't complain. They shouldn't be complaining about nothing because they don't go through nothing. Women, we bleed for a week, a whole week. During every month of our life, from like 11 or 12 on, we go through so much stuff. Our boobs get squeezed by a machine. Like, we go through so much. A woman is a superhero. A superhero. Men just, they got it made. We push out babies out of a little tiny hole. Like, we are amazing. The day a man complains, like, don't complain. You should be 100% because you don't go through nothing compared to us. And every time we think that we're good, the following year something else happens. So, anyways, I won't say anything else.
Thank you guys so much for all of the messages. I read your messages. Thank you. I hope this helps somebody. I did a video like this for my thyroidectomy. All of this stems from having a full thyroidectomy in 2014. Thank you so much for caring, for watching, and if this in some way has helped you or you have any other questions, feel free to leave a comment below, and don't forget to subscribe to my channel.